Go. I always wondered whose voice that was. That'd be interesting to find out at some point. Hey, ladies and gentlemen, welcome to Children's Oncology Camps Association and with our Gold Ribbon Accreditation Camp Orientation. I hope you're in the right place. Glad you're here. And I'm here actually with two other great people. Before we kind of get started, I want to introduce those. You probably know Jennifer, our Executive Director. Say hi, Jennifer. There she is. And Jennifer, do you want to make an introduction?
I do. Thank you, Brian. Yeah, I'm so glad you guys are here. Thanks for joining us today. And I'd like to also introduce to you COCA-I's new program manager. Callie Campbell is on this call with us, and she is going to be your point person in helping you with accreditation this summer. So you'll get to know her very well. Very excited. Today's Callie's first day. So
first day. She gets oriented. That's
already
right.
Had a lot going on.
Cool. A couple of requests as we move forward. If you can put your call on mute, it's just easy. I know when somebody walks in my office and needs to know something, they don't realize I'm on a Zoom, and it just keeps that sound out of the way. And also, if you haven't already, if you could just go into the chat, put down your name, put down the camp you represent. That's awesome. That would be great. That would be great. And what we'll do is we have scheduled about 90 minutes. And so there'll be some time for questions and answers and those kind of things afterwards. I think we're also lucky, as I know we have at least one, and we might end up having actually two individuals that are also on our Gold Ribbon Committee. And so once again, I just want to say that more than happy to have them chime in if there's a nugget of knowledge for all of you that are going to be camps and are going to be visited. That would be great along the way. And just to let you know that as I kind of go through this, this information, and Jennifer will be going through some as well, please, if you have questions, just take yourself off mute and ask, or you can go into chat. We try to monitor that. I'll be honest with you, doing both of those is not my skill, but we're lucky enough to have Callie, and we're also lucky to have Jennifer here as well. So why don't we just kind of kick off if everybody's ready, and here we go. So what is accreditation? And so wanted just to make sure that we all have kind of the same lens with regards to accreditation process. And so this is a long statement. Let me kind of break it up. Really, the philosophy of accreditation for COCA is really, this is an education program. And by that, I mean, we're really here to help camps take a look at what I call foundational practices for running an oncology, a pediatric oncology experience. And it's a chance to kind of learn what those foundational practices are so that our individual camps, if they're not already doing it, can exceed that. And then as we talk about, as you also hear the term, best practices. So really, this is all about education. And so we really come to it with that lens. And I know, a matter of fact, in the next couple of weeks, we're going to be doing a similar orientation with visitors, and those are those that will be coming to visit your camps. And we use this this optic as well, is that this is an opportunity for us all to learn, for camps to learn, as well as visitors to learn how our wonderful camps are doing this across this continent. The other piece is with accreditation is that it also takes a look at identifying what policies, practices, and procedures that a camp has that are specific to their setting and to their population. And I put in that specific to their setting because we have camp programs that are running next to hospitals. We have in the city, we have day camps, we have that kind of thing. We also have ones that are very remote and might be in wilderness areas. So where they are may impact some of the practices, policies for their camp. And so we always like to make sure that you have that lens, is that when you take a look at developing your policies, practice, and procedures, you keep in mind your setting, where you are, what the access is, and then also population. And we all know that we do pediatric oncology camp, but that comes in many different ways, because we do that patients, we do that siblings, we do that for families, and you know, that includes the adults, the parents, or the caregivers. So once again, all of these policies and procedures should be specific to how you operate. They're specific to you. The other thing is that what really makes it an accreditation program is that these policies and these practices are documented. And by that means is they're actually written down somewhere. They're understood by the organization, and therefore it's kind of not only a legacy for year after year, but it's also something then to go revisit as you may have situations or you have learnings or other kind of things, and you can improve upon those instead of having to recreate. And really, accreditation says not only are they documented, but then we actually have third-party individuals, folks that aren't involved in your camp program, to come and witness that they're actually being delivered. And that gives that sense of, okay, so we've had an objective person outside saying, yep, they have the documentation, and yep, we saw it's delivered, and therefore we can put the moniker that it's accredited. So that kind of gives you kind of that feeling of what that is. Question about that? Okay. So what they are, and as I kind of mentioned this before, is they're foundational elements to what we consider as a safe program. And I really you'll hear me probably say foundational elements a lot of ways, because we know that people do even more in depth or more involved than maybe the standards require. And that's great because that's your program. But from a point of view of standards, they're at least the foundational elements that have been created by a group over many years that operate camps, and we are constantly looking at it. We're looking at a new revision right now. It also takes a look, and as I said, in the areas of practice policy and implementation of a pediatric oncology camp, and it's verified by a third party. So I talked about that. The note that's down here is please know that really the standards that Gold Ribbon has created are really in the context of what we would call overnight camping programs, day camp programs. They're not written, and we know that many of our member camps, they have single day events, or they might have hospital programs or those kind of things. And really, these standards were not designed to relate to those. But I can say, if you are doing some other kind of event, like a day event, you might even refer back to these and say, hey, are there things we ought to have in place, even if it's a day event or if it's a hospital program. But for the point of this visit and for this summer, really we're taking a look at those overnight camp experiences and day camp experiences. What accreditation is not, as I always say, it's not a collection of how-to documents. We don't come up and say, this is how you're supposed to run your camp. That's for you to do, and every camp does it uniquely, wonderfully, and does it in their own way, and that's a part of your culture. That really standards are not there to prescribe what kind of practice you should do. That is up to you. And so part of it is that education, self-education. Standards ask a lot of questions. What do you have in place to deal with these kinds of things? And then you get to develop that policy, that practice, and you get to decide what works best for you. The other thing is that we try to say is that it's not an inspection. We're not there to inspect or to judge your practices or policies. We just say, hey, these certain things are important to have a policy about. How you do that is really up to you. Now, I will say that there's many visitors that are out there. There are many of us that are doing the same things, that if you're not quite sure what to do or how deep to do that we can help you, as well as we do have, and we'll talk about this later, sample policies, sample practices that are written up that then you can take to help educate yourself and think about, hey, am I covering everything that works for me? Hey, these guys talked about this. Does that refer to me or not? And those resources are not made to be cut and paste, but instead just to help the educational realm of the standards program. Another thing is talking about COCA accreditation versus other kinds of accreditations. Many of us know hospitals we work with, they go through accreditation processes. There's all kinds of different accreditation processes. So many times we hear, oh, the facility we use is accredited, so we're good. And actually, I would say to that is that, member camp, and that's the COCA member camp, can be accredited by another camp association. That could be the Ontario Camp Association. It could be the American Camp Association. All those kind of things that member camps can be accredited by others. For instance, I'm here in Los Angeles, so we are accredited by the American Camp Association as well. But American Camp Association, as well as other camp associations, may not deal with and don't deal with the depth of the medical and the psychosocial realms that COCA dives into with regards to standards. Also facilities. So also I have a facility, lucky enough that our organization has a facility, and we also accredit our facility. But once again, if another COCA member camp comes here, that doesn't mean they're accredited. It just means the facility is accredited, but the program may not be. And so it's one of those things to kind of think about. And really what it comes down to, accreditation, is control. Who has the direct control or oversight? And actually shouldn't be S-I-T-E, it should be S-I-G-H-T. But anyway, or the direct oversight and control of the different activities. For instance, some of our member camps go to a facility and they supply nothing more than a bed and food service. And when it comes to counselors in the cabin, that's up to the member camp. So if the site and facility is accredited for the food service and for the facility, that's great. But those staff, how they're brought in, how they're used, how they're screened, is not overseen by standards according to accreditation. But that's up to the member camp. And so we like to kind of do that and make sure that people kind of understand that. The other part that I would put down here is we are accredited by. So once again, just think about the medical and psychosocial practices. That even though I know that my camp, and I'm using that as an example internally, that I'm accredited by a camp association, that it doesn't cover my medical and psychosocial practices. That's why I also participate in COCA and COCA's accreditation. So I just wanted to make sure that that was kind of clear for folks. Questions about that? Okay. So let me talk a little bit about the benefits of a gold ribbon accreditation. And so we hope as an association that we're really providing education. We talked about that. It's an opportunity to get informed, to continue education on what are those best foundational practices for oncology camps. The other thing is a sense of confidence. I know that for me, it allows me to go to bed a lot easier, that I have thought or I've been educated on certain elements, and that I'm prepared in a policy, procedure, or practice to make sure that my operation and those kiddos that I'm serving are as safe and well taken care of as possible. And so it gives me confidence knowing that I'm going to an outside source that has helped me think that through and developing these practices and these policies. Last is we hope that gold ribbon provides some kind of stature. And by that, I mean that accreditation from an outside organization can tell your parents, your donors, your community members, even your hospitals, that you as an organization are really looking to do the best for these kids and to provide the best, safest experience. And therefore you've sought and the accreditation process. And so be comfortable, and I would say be ready to use that, because we know that there's many different programs that our parents, that our healthcare providers can refer, our parents can choose to go in, as well as our kids. So knowing that it has some sense that they've been educated on the foundational safe practices, hopefully will increase their comfort. So let's get into it and talk a little bit about the process. So the process, and I'm just going to kind of do this as a kind of a high level, the camps that wish to be accredited, because it is elective. It's not something you have to do in order to be a COCA member. So it's an elective process that your camp has decided to do, is you put in an application. Those were November, December, they filled out those applications. And then for those that are looking to be have an accreditation visit for this year, then go through a virtual accreditation workshop. Congratulations, here you are. And it's March 1st. I love that. What the next step will be is that as the camp that's looking to be accredited, we're going to ask you to submit documentation related to all of the standards. When I say all, there's 28, I think, the last count. 28 standards, and to do that via a portal. And so we have a virtual portal to do that. We'll talk through that in a minute. I will say, just out of support to our staff, is we have people that are involved in many different accreditation programs, and they have come to us and said, COCA's portal is amazing. It's so user-friendly. It's so easy compared to so many other processes. So hats off to our staff. I know it's a lot of work, and a lot of things just to keep that up to date and going. But we'll talk about the portal a little bit later. But just know that you will get information on how to upload your documentation, and you will get that from the office. And once again, we're thinking that about April 1st to begin that process. Then what happens is there will be a team of reviewers that will be assigned to your camp. We're going to talk about that. And these reviewers are actually volunteers, they're visitors, both from a peer point of view, meaning they operate a camp themselves, or from a medical point of view, they're involved in camps and they're some kind of healthcare professional. And they will go through and review the documentation that you've uploaded. If there's questions, they'll be able to communicate with you back and forth. If they need additional information, they can make that request. Once again, it's a dynamic process going back and forth, because our goal is to have all documentation reviewed, completed, and accepted before the visit in June. And that way we know that when visitors are coming to actually visit the camp, they don't have to go through a lot of paperwork. Instead, they're taking a look at the wonderful things you do. They're taking a look at your operation. They're taking a look also to say, hey, are they doing what they say they do in their documentation with regards to, for instance, medication administration, with regards to, how they run different parts of their operation according to what they do. So the documentation, once again, we're trying to get that out of the way so we don't just have a visit and we're going through paperwork. Then there's an on-site visit. Right now, we gear towards June and August. We hope at some point we'll be able to even expand that to be able to accommodate camps that maybe run family camps in fall or spring or those kind of things, or day camps that maybe run other parts of the year. The majority of our visits are June through August. And we'll talk about the visits coming up. Just to let you know what we ask for at the end of a visit, that we get a visit report from those visitors. They actually need to report back to COCA, and actually the committee specifically, saying, yes, they visited, yes, they've gone through the documentation, and with the visit, they've witnessed these things, and they are what they say they are. In other words, they are following their policies and their procedures. If there is something that they have concern about, that's also where they let us know. And then as a committee, as staff, that's where we talk with the camp and with the visitor and figure out where there might be bumps, where there might be additional documentation needed, those kinds of things. But we ask for that report. That report goes to the Gold Ribbon Committee, which then meets in September. And what that committee does is actually review all those submissions. And it is the committee's responsibility, besides maintaining the integrity of the standards, is also to recommend which camps to be accredited to the board. So I want to take a minute real quick and just say that visitors don't award accreditation to camps, and the staff don't award accreditation to camps. The Gold Ribbon Committee does not award accreditation to camps. The only one that can say a camp is accredited is the COCA board. Now, once again, there's recommendations and there's those kind of things that go forward. But I just want to let you know that, like, after you have visitors come out, it's kind of like, did we pass? Are we accredited? Not until we go through this process. So I want to make sure that's clear with everybody, that they're just there to visit, to report, and then we go through the approval process. And soon after, in October, that's where the COCA board meets. That's where they review the recommendations, if there's questions, those kind of things. And they award accreditation typically in October. Questions about that process? Okay. Next up is the key to what we have found, the key to accreditation, the program success for this really comes down to a couple things. Well, actually, yeah, a couple things. Number one is communication. By the way, number two is communication, and number three is communication. So you're getting the theme here? So the real key to this process is going to be you as a camp involved in this gold ribbon process, making sure that you're communicating with your visitors, with the office, because there's a lot of details that go through in this. If there are things you don't understand ahead of time, communicate with us. This is a year-round education process. So let us know, but we need to hear from you. So email us, call us, those kind of things. And a couple of things just to kind of think about with communication is, once again, is with the camp representatives and the visitors. At one point, you'll be assigned visitors to review your documentation and to come visit your camp. That means that there's a lot of information that needs to be discussed with regards to selecting the best date for the visit that works if you're only running a 1-week camp. If you're running, a couple sessions, what day is are most activities going to be observable? When are medical services going to be observable? When is the camp director or the one that's working with accreditation on behalf of the camp and the camp's healthcare staff, when are they going to be available to be able to be talked with, to be able to be reviewed with, to ask questions of by the visitors and to observe? So figuring out that date's going to be most important. And that takes communication, and that takes some scheduling. As we all know, sometimes scheduling is the hardest thing to do. Including in that is sometimes, if they're traveling, what's the closest airport to the camp facility? It may be a small regional one, it might be a big one, we don't know. But it's just kind of, what if they're coming in, and we try to have visitors that are fairly local, but that doesn't always work. To have that communication on where's the best place to come in, also economical, those kind of things, also help with getting to camp. So once if they come in from an outlying area, are they going to drive there? Do they need to rent a car? Do they need to take a ferry? We actually had visitors that go over and they had everything ready and they got there and all of a sudden they had to take a ferry to the camp. It's like, how does this work? Because that wasn't discussed. And so once again, just kind of thought about how do they get to camp? Now, I will right now kind of put in a shameless plug for our wonderful sponsors, which are Care Camp. So Care Camp, as a philanthropy, they actually fund camps to go through the accreditation process. That includes the expenses for our visitors to go out to your site, to visit, and that might get there. It might be staying overnight before or after, depending on what the timing is. So, we're trying to be good stewards of their donation. So a couple things to think about is what is the easiest way to get there if they're coming up? Also, if they are going to have to spend the night, is there a possibility they can spend the night at camp? And of course, that would be an adult appropriate area to sleep, not in the cabin. If not, that's okay. We'll get accommodations, hotel rooms, those kind of things. But any way that you can help us with getting, if it's a ride from the airport to your camp, if it's a overnight stay, if it's those kind of things, all that kind of helps the budget. So I'm just letting you know that don't feel like you have to, but because we don't want to make sure, because we know you're running camp as well. But any way you can help this out helps our donor go through and do that as well. Okay. And last is when a camp, depending on the time, can the camp offer meals to the visitors? If it's going to be over lunch or those kind of things, is that something that's okay? Is it not okay, depending on what your arrangements are with the facility? Just let them know, because we want to make sure our visitors are fueled up to be able to do their observation. Questions about that? I should take about 2 seconds and say all of these slides will also be sent to you. So if you're looking at it where you want to see the recording, or you just say, hey, can I just see those slides again? We'll provide that resource to you again, just so you're going to have that hit list. Lastly, the other thing is, we know in this day and age, we got to bring it up, is COVID procedures. So we're still living with COVID, as we know, and different camps deal with this differently. Different areas of our continent deal with this differently. So the big thing is to also communicate to your visitors what your expectations are with regards to COVID procedures. What testing do they need to do be ahead of time? Can they be tested there? Masking, all of that. Because once again, if our visitors can't accommodate that, we'll find another visitor. But we want to make sure that our visit is at least impactful. And that's also keep making sure that you have the integrity of a healthy community while you're doing your camp. Okay. Goals of the visit. Visitors witness, like I say, all that documentation, procedures, and practices in delivering the program. That's really what they're there to do. We even have, and as you look at the standards, and by the way, the list of standards is actually on our website. If you go into accreditation, you can download that as well. I'll refer to it a little bit later. But there's even in that, there's a worksheet that's for visitors to say, what are the things you definitely need to see? Because there's some things you just see in documentation, but there's some things when you're on site what are good to check out and verify that you've seen. If you want to see what those are, you can just go into, we're very transparent, you can go into that visitor packet and see that there. We also, we want visitors and the visit to be non-obtrusive and disruptive to your program. We don't want it to be the evening activity of, oh, COCA visitors are here. Also, we just let our visitors know too that they're there in the background just to kind of see kind of what's going on. So if there's a way that, if there's a big activity going on, if there's those things, just let us know, because we don't want to be disruptive or obtrusive with regards to what you do. We just want to see it in action. And our visitors, we ask them to take that posture. Last is that one of the goals for our visit is to promote collaboration between camps and the visitors. I will tell you, the visitors that come out and that we've had in the past, they love coming and seeing how other camps do things, because that's education for them. The other thing is that many of them have been doing this for a long time, and maybe in a different way, or see some things in a different way, or you might have a question that's unrelated to the standards, but wondering, hey, as a camp operator, how are you doing this? Or as a nurse or a physician, what should we be thinking about with this that maybe is unrelated to the visit? But know that you have some really skilled and wonderful people there, and know also that they're going to be loving seeing what you do, and may ask if they can borrow that song, borrow that story, or hey, can you share with me the procedure of that arts and crafts? I love that, or something else. So it really is a collaboration. And that's one of the things that we love, and that's one of our goals about a visit. Question about those? Okay. The on-site visiting team. So yes, we want we say the camp director, but really it's the person that the COCA camp has, that knows the process they've been through with regards to gold ribbon standards and can speak to those. That could be a camp director, it could be an assistant director, I don't know. It just all matters. Every camp does it differently. But at least we want to know some person, we want to be able to make sure that they're on the team the day of the visit, whoever that person is, that can guide us to the right things to see, can show us the camp. Also, the camp healthcare professional. Does it need to be a doctor? No. Does it need to be a nurse? No. But it needs somebody that knows what the healthcare delivery is at a camp and how that runs and is a part of that. Because those are some of the things that we really want to see, being that our program, that accreditation from a COCA point of view is really medically and psychosocially based. So they want to see that in action. What you can expect is, in the past, we've been doing a volunteer peer professional. Like I said, somebody that's been in camping for a number of years, and a volunteer medical professional. And that can be anywhere from a pharmacist, it can be a nurse, a doctor. There's many of those, or psychosocial, many of those, and this is the team that would come to visit. So really, it's kind of what I would say is the four that will go through and do the visit. And that's why you also have to think about, as I put here, when you set up your time for the visit, to make sure that this director or this leader of the camp and somebody from the medical staff are available. Because all of a sudden, if you got to run off and do color wars, or all of a sudden, if they're only on call that day and they're not on site, that may not be the best time for the visit, because the visitor is going to want to have conversations. They're going to want to see how that's done in the visit. So think about that when you arrange the time and the date for your visit. Question about that? I feel like I'm running through pretty quickly, but I want to make sure there's questions. Okay. An overview of the visit. This is the fun part. Number one is visitors want to see what you do. Show us the wonders and what makes your camp so special. You know, how does a meal work? How do activities work? How do cabins work? All that kind of thing. We just want to, you know, certain activities, how do they all work? Because we want to see the good things that you're doing. Yes, during a visit, they're definitely going to want to observe medical administration, medical services in action, whether or not that's distributing medications, however that works for you, whether or not if somebody comes in and needs a boo-boo Band-Aid, how that's being taken care of, those things they'll want to observe. The other part is I want to put it right up front that visitors are actually asked to have conversations with others than just the medical professional and the administrative person, but talk to counselors, talk to program leaders, talk to others that are on site with medical, because that's the way you kind of get a good idea. They're not trying to catch you doing something that you didn't say you do. It's just, it's great. I love to go in and say to a counselor, tell me how long you've been in camp. What do you love about camp the most? And how did they prepare you to do this job? And that way they can kind of talk about what their experience is. They can be, a chief on that. If it's having something with an, those kind of things, I love just to kind of see. Talking to a nurse and doctor, hey, how do you guys deal with this kind of a situation if it comes up? How do you know what the camp wants you to do with these things? That way, it's not saying that we don't trust who's going to be those visits, but that way we know that information is being trained and disseminated out. So don't be intimidated by it. It's not trying to catch that wrong. It's just trying to make sure, are they practicing what they say they do? Okay. Questions? Cool. Well, let's talk about some of the tools and some of the support we have for you for this visit. And what we're going to kind of start to talk about is what we call the Gold Ribbon Portal. So I said earlier that one of the things is uploading documentation with regards to the different standards that we have this portal. And so I'm going to ask Jennifer to kind of help. I'm going to click sides, and Jennifer, you can kind of guide me through. But we're going to kind of do an overview of what this portal looks like and what the opportunities are. Like I said, these slides will be given to you as well. And as you go through the process of uploading and having that conversation, if ever you have questions, you can reach out to Callie, you can reach out to Jennifer, you can reach out to me, those kind of things, and we'll help you through it. Okay. So Jennifer, tag, you're it.
Yeah. Okay. Thanks, Brian. So to access the portal, we'll provide you a link to the portal. Each camp will be assigned one unique email and one password to log in. And so I know some camps have, multiple people that will probably be needing to access the portal. Maybe your medical director is going to put all the policies and procedures up there that are related to the medical components of the standards, and that's okay. And maybe the camp director or the program director is going to do all the other things. But we've just assigned one camp a login email and password just to keep it simple and easy for you. So we'll go on down. So this is the purpose of the portal, to help you. One, lots of people still operate, believe it or not, from that 3-ring binder with all of their camp rules in it. And we really want to help you organize your files better by digitizing everything that you have, from your volunteer manual to your, policies for accepting campers that come to camp with a DNR. So that's really the purpose of this, and it just keeps it more organized on the COCA side. So we also have in this portal, which Brian commented on earlier, examples of each of the standards from some of the camps who have gone through accreditation visit, or some of the camps that early on helped us develop these standard examples. So we have those for you to be able to look at. So if you don't have a written policy for one of the standards, you might want to look at it and just get some ideas about what would work in your camp setting. You'll upload your files to this portal. You'll be able to add comments, questions, and it's really set up to where you can communicate with your visitors and interact with them. So we'll also be able to assess your progress. Like if you have logged into the portal and uploaded some new documents for, say, standard 2.1, and you go through the portal, you can send at the end of the portal, which I'll show you on a screen in a minute, but you can actually send the visitors an email that says, I've uploaded more documentation to standard 2.1, log in and take a look. So It's pretty easy, I think, but you know, my head's been in it for a long time, and really this portal has been developed by all the camps that have gone through accreditation and the visitors. I mean, we've really listened to what everybody within COCA has told us, what works, what doesn't work. Hey, have you thought about a new feature like this? And we really listen to it. So the success of it is really due to our camps and the visitors that have been a part of it already. Okay, Brian, next slide. So, okay, so here is where you access the portal. You always go to COCA-I.org, and you will, on the right side of the home menu, you'll see Gold Ribbon Accreditation Program. You'll click there, and then the next screen on the right here, it has a portal menu bar. You'll click on that. And the reason we want you to always go to COCA to access the portal is because we're constantly like fixing things on the portal or making updates and changes. And so at times the link, you know, may change slightly, and we want you to have the most up-to-date link. So that's why we want you to go there. So when you first get to the first page, you'll see is this, and this is where you will enter your unique email that you'll be given. It's not your, you know, your email at Camp Periwinkle. It's an own Microsoft.com email that we'll assign to you. So you'll put that in there and hit next. And then you'll go here and you'll enter a password that we will give you. So you can change this password after we give it to you. Or you can keep it, whatever you decide. And then when you sign in, it may ask you if you want to stay signed in. You don't have to, yes or no. And then you're going to come to the home page, and this is where it's going to say, you know, welcome Camp Quality Canada. And it's going to have your camp's name there in the box where it says Camp Test, and you're going to hit Let's Go, and it's going to take you to the first standard screen, and we'll go on to the next page. There you go. So you'll actually come to this page first. This is kind of like another home screen. So on the left side where it says Key Contact, this is where the camp's information will be. So for example, Smile a Mile, I have two contact names. I have Carrie and I have Kelly. So I'll put their names there, their phone numbers, and their emails. And then on the far right side where it says peer team member and medical team member, this is where we will list the visitors that will be coming to your camp. You'll have their email as well as their cell phone number. Okay. And I'm going to reference in the top left corner of this screen, you'll see where it says all peer medical. So this is, we have taken all of the standards, and you can click all and see all of the standards within the portal, or if you want to just see standards that your peer visitor is going to review and accept for you, then you'll click on the peer. Or if you want to see all the ones that the medical visitor is going to review and accept, you would click on that radio button. And then on this little drop down menu where it says all standards jump menu, if you click on the down green arrow, it'll have all the standards there listed, and they're listed by their numbers, like standard 1.1, standard 2.1. And you can easily highlight one, and it takes you directly to that standard screen. So it's pretty quick and easy. Now, under the review status area, so you see here, this kind of helps you keep up with where you are for your standards that are being reviewed by the visitors. So I'm going to start on the far right under the pending column. So these are maybe 4 standards that the medical or peer reviewer are in process of looking at for you, and maybe they haven't, you know, checked the box yet that says that what you have provided to them, either in a file upload or a written comment, is accepted yet. So it's in the pending column. But all of the standards that have been checked off by the peer or medical visitor are now listed in the approved column on the left. So this kind of gives you a quick reference when you log in and you go, oh yeah, I need to go back and go to 3.6 and give them the answers or upload the file that they need. So going to the next screen. Not really sure why it did that, but anyway, just go to the next one, Brian. Okay, so I think I pointed that out to you. All the navigation options. Okay, so in the top right, you'll see the next button. That actually is the button that helps you go from one standard to the next. But if you log in and make all the updates that you need to do, there's always the update and exit button in the top right. So if you don't want to, scroll through all the standards, you don't have to. You can quickly choose that button and then exit the portal. So let's go to the next screen. And I think, okay, so this is the explanation for what's on the next slide, Brian. Okay, so you're looking now at standard 1.1. So all of the screens look the same as far as the format and the setup. You'll see you'll see the standard listed on the left-hand side there. And there's a little, that little scroll will scroll down and show you the entire standard, and it'll show you, how you need to comply to the standard, what's required. Is it just a written comment that's needed, or do you need to upload documentation to answer the standard? But that's where that is. So where the file upload button is, you'll click that and upload any documents that will help answer this standard. Okay, and you'll see them listed there on the right, where it shows 2 files are uploaded. You can easily, if you upload the wrong file, you can easily go to the garbage can and trash it, and then go back to the file upload button and upload another document. You can see you can also download that file if you want to, but you more than likely will just be using the file upload button. Okay, so in the box below where you've uploaded your files, that big white box there, this is where the camp can write any questions, comments. Like I mentioned, if the standard just requires a written explanation for something, this is where you can write it. Okay, and what's great is when you log into the portal and you put something in the comment box there, it's going to timestamp your comment. It's going to have, smile a mile, 3/3/23 for the date, and then it'll have the time that you made the comment. And then if you go back later and make another comment, it will timestamp that, so it'll be in order. Okay, and we do that for the visitor's purpose, so they can, when they log in, they can keep up with new information being submitted. Now, in the bottom left of this screen, you see view standard examples. It's the bottom left, blue button. That's the button that you can click that will show you examples for that particular standard. And so in the far right box, the green box here, so this is the box that the visitors will be using. So this standard is a peer standard, and they will be doing the review for standard 1.1, and they will check it. If what you have provided answers the standard, they'll check that little box by peer, and then they can make comments in that white box below the peer check mark box right there. Now, one thing I didn't mention, and I'll go back. So you see the blue button on the right side, it says add new camp comment. You'll click that first before you go up to your white box, to type something in there. Okay. Any questions so far? I know this is a lot and it's technical.
Hey, Jen.
It's easy, yes.
Hey, it's Kel. If we make a comment, or the peer reviewer makes a comment, will we get like an email that says like that there's been something commented on, so we'll know if we want to go log back in, or how will we
Yes.
be notified of that?
Yes, I'm going to show you that screen in just a minute. Thank you. This is
Okay.
one of the new things that we've added. Okay, let's go to the next slide, Brian. Okay, this is showing you some of the standard examples that I mentioned a minute ago, and you'll just click on the PDF there that's listed. So that's what it looks like when you click on the view standard examples. Okay, so this is the last, when you hit that, exit button in the top right, it's going to take you to this page, Kelly, and you can easily send an email. So you'll see where it says team members over on the right. So your peer and your medical visitor will be listed there. And you literally just click on their name and go to the to box and put it in there and type a message. And then it'll, you click send email. So they get an email from you. And then if you just decide, well, I'm going to exit the screen, another message will pop up and say, are you sure you want to exit? It's kind of just a fail-safe thing, but this works both ways. Camps can email the visitors, and then the visitors can email the camps. So hopefully that will be.
Yes, thank you.
Mm-hmm. Okay, Brian. Okay, so this is kind of what a message might look like. It'll have our logo at the top, and then you can't read it because it's so small, but to the left of the word message, there's the email is typed. And then it just gives you a summary report of where you are on standards that are pending and standards that are approved. And this summary report is the camp gets it as well as the visitors. So it's just kind of a reference you can have. Okay, Brian, is that all? I think that's it.
I think that's it. Yeah.
Any questions? And look, y'all, there's no silly question, stupid question, because when you're, learning something like this, you're just trying to figure it out. So reach out and let us know if you have any, issues or problems. It's common sometimes if we have a file upload issue, but if you'll let us know about it quickly, we can probably get it resolved quickly.
And I will just add that as you go through this experience, is at the end, we will ask, but an evaluation. But if there's something you think would make it easier for you, something that we'd like to see added, we appreciate all those comments. It's not like we failed, it's an opportunity for us to improve. So appreciate that, both from visitors and from camps. Yeah. Cool. So a couple of, as you can see, there's a lot of uploading of documentation that we do on this. A couple hints. Number one is, please know that our reviewers and our visitors are all volunteer. Just like many of you, this is maybe not their vocation, but their advocation, and they're taking it out of their time, and they're doing it because they want to see for the betterment of all oncology camping. With that in mind, some things that you can help with to make it easier on the document reviewers when you're using this portal and you're doing uploads. Number one is upload the specific policy or practice or procedure that's related to the standard that you're on, compared to, hey, here's our entire policy notebook. It's in there. Because a visitor doesn't have to go through and try to find that all. So if you can even just scan that one page, that would be better. Even more wonderful, highlight the wording that's related to that standard. If you scan it, highlight it and say, so this is exactly for, this is the procedure, this is the policy for standard 5.3, and here it is. That just makes it easier in the review process to be more exact, not to have to search and find. As wonderful as your policy, procedures, personnel manuals are, but it just makes it a lot easier, and allows them then to approve or ask questions specifically for that standard. Okay. I had this is the exit. Oh, we already did this, didn't we? Yeah. This is the exit screen. I don't know why I have that on there again. I have it on here a couple times. It's so funny. Okay. So for tools for accreditation, you saw the portal. Become familiar with that. You also, we mentioned the resource library of policies and procedure examples. So those are two of the ones that are most out in front to be able to support you. And then I'll go back to communication. If you need more, if you're not sure if something is going to meet the standard according to how it's written, reach out and ask. It's no harm, no foul. We're here, it's an education program, so we wanted to let you know about that. All right, everybody good with that? Take a deep breath. What we're going to do next is let's talk about some specific standards. I don't know if you've had, I hope you've had an opportunity to take a look at the body of work that we call standards. They're organized in a certain way, so I'll just kind of overview this really quick. As they are numbered, we have standards that are 1.1, 2.3, 5.7, as you can see. So we actually use these, and these have different general camping, clinic and hospital affiliation, administration, staffing. As you can see, the largest amount is in healthcare, and we also have psychosocial support. So that just kind of shares with you the organizational system for our standards. For each individual standard, there's also organization. You will see, and we'll see one in a minute, that it has the standard up front, ready to go by its number. Then there's a thing called an intent statement. It's a dialogue for most, I think they all have it, that basically said, here's what we're asking, even though it's stated this way in the standard, but this is why it's important, this is what we're asking. And then there will also be a section that's called compliance demonstration description. It might be provide a copy of the policy, blah, 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 or provide us with a copy of the procedure of blah, 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 blah. It might be, hey, a compliance of this is a conversation with the camp director on this, okay? If there is written documentation, and for a lion's share, they will actually also be an icon just to remind you that, yes, we need something written and uploaded with regards to this, okay? So that's kind of how standards are organized. Are you ready to look at a standard? Here we go. So the newest one that happens to be with us is an example of a standard is standard 1.1. Kind of wanted to go through this a little bit and kind of share with you what the process might be. So it's just asking, does the member offer programs and facilities that meet organized camp operation standards? You can see there's an A and a B. So in this, A would be by a recognized camp association. So what does that mean? Because we're asking them to see if they meet organized camp operation standards. So to let you know what that is, I also want to refer to a helpful piece within standards, and I'm going to try to drag this over. It's going to let me, hold on real quick, see where the drag, oh yeah, there it is. Well, you going to let me do this? Yes, I'm going to drag this over and put this up. So within standards, there's actually a page, a little bit more than a page, that's definitions. So it's kind of like, what is an accredited recognized camp association? They're listed here. If there's a camp association that you've been accredited by that's not listed here, that's a great opportunity. Let's have a conversation. There might be one that we don't know about, but they're in here if you are. Also, just to let you know, it's kind of like, what's the definition of a camper? That it is siblings, survivors, parents, guardians, that kind of thing that participate in a program. So it's not just a patient. It might be whoever those folks are. So from the healthcare, we're not quite sure what a healthcare provider is in a standard, but from a licensed independent professional, but again, you can kind of refer to this. So I wanted to let you know where that lives within the body of work. Okay. The next piece of this. So as you can see in this one, and I even put it down here, recognized camp association. You can see I just did with the standard definition. We talked about where the standards are. So if you're not accredited by a recognized camp association, and this is the member camp, that's okay. But what we ask is for you to provide written descriptions of operating procedures that describe the program of organized and supervised activities in the following areas. And there's a laundry list of things here that are both facility and that are both program. And so part of the thing for the camp is to go through and figure out which ones of these apply to them, and then to write a simple explanation, a description of what that description of the procedures are in dealing with that. Now, we know that for many that aren't accredited, which I want to say, I don't know exactly how many of our members, but many, that this is a large body of work to kind of go through and do. And I want to give some of the rationale is because I think that as we go through this, that we realize that pediatric oncology camping is more than just medical and psychosocial. It's also operating these recreational services. But Gold Ribbon and the Gold Ribbon Committee and COCA really decided that that's better handled by other associations. It's not our expertise, that we're really the medical and psychosocial, so we refer to the others. But being accredited by a camp association may not work for some in the States. And so we just ask you that think about what are those foundational practices to be helpful for this. As I will say again, and in this body of work that we call the standards, and I'm going to kind of go through all the standards here, at the end, there's even kind of a helpful guideline of how to deal with 1.1 and what some of those, right here, an appendix that has questions to kind of ask yourself when you go through and do your written description for every single one of those bullets. So if you do say, oh, I need to do these because the member camp is not accredited, great, we can do this. If it's facilities, it might be, hey, our facility's accredited, so they're fine. But if you control it as the member camp, not the camp facility, some of these might answer. So we try to give you a little help and assistance here, just to kind of let you know. Questions about that? Okay. So let's take a look at another one. This is actually an example of standard 5.2. And this one actually goes through and I want to say really talks about what written protocols are available on site. And once again, protocols have to do with the medical care of kids, whether or not if it's treatments, whether or not if it's responses. It gives a list of the different kind of protocols. Actually, this day and age, communicable disease. We all know about that. It doesn't say COVID specific, but COVID is a communicable disease. So as a part of communicable disease, what communicable diseases might you have? Is it what works for your camp? Is it COVID? Is it flu? Is it head lice? What are some of those things that would be specific to you that are most likely to deal with? And do you have a protocol for handling that? And so that's where this actually says, once again, do you have these written protocols and are they available on site? Because the medical staff and those that are going to be administering this are going to be on site. So having a copy on site is considered important. The other piece is also that's specific to your operation. I know that we have some member camps that are related to the hospitals in which they get campers. And lots of times with these, for instance, it says, what do we do as far as central line care? They say, well, here's our hospital protocol in dealing with central line care. But that's not the camp. And so you may not have that equipment available. You may not have that expertise. So what's specific to your camp operation? You might be able to use the hospital guideline or protocol and adapt it so it works for you. So it's important to know that it's specific to your camp operation because you're not running the hospital. And I know I'm very thankful for that. And I'm thankful for those that do. I just run a camp and I have a smaller responsibility than that. You will also notice on this that it's been approved by an independent licensed pediatric oncology health provider. The reason we do that is we can, as a camp staff, we can come up with these, but we want to make sure that it has the oversight of someone that works with these kids all the time and is familiar with how camp works. So knows the location where you're at, knows the population you're working with. So that's just another important part of the standard. So for reviewing the standard, when you upload documentation, they're going to be looking for, is it specific to your camp operation? Is it approved? And then with a visit, they're going to say, do you have a copy of that here? That's how that works. Okay. The other pieces you can see, there's yeses. There's also DNAs. There may be, there may be a situation like, I put it under here in a central line, but you might have an eligibility requirement that you're not going to be doing administration of IV oral chemotherapy. So why do you need to have a procedure in that? That would be a DNA. It may be that you're not doing transfusions. That could be a DNA. It may be that you don't accept kids that are on central lines. So that would be a DNA. Most of the others are pretty general. That's why there's not DNAs. But there is a section where you can come through and say, with regards to when we're looking for these written protocols, the visitors are going to be taking a look. Do they do communicable disease? Is chickenpox shingles in here? You know, which ones apply and are they listed? Okay. Now, along with this standard, just to kind of describe how they're done, you can see where there's an intent statement here. So if you're questioning why this and how this works, it's a great thing to go through this intent statement with regards to why it's there. It may clarify exactly what is intended by that standard. And then you can also see a compliance statement or a written copy of medical treatment protocols signed by an independent licensed pediatric oncology health provider within the last year, because gosh only knows things change constantly. Okay. And a matter of fact, I think my next slides just kind of go through that, dealing with common incidences and occurrences at your camp. If you have a lot of bug bites, if you have a lot of those, you know, what's specific to your camp? And once again, customizable, I talked about this, and screening methods for minimizing the spread of those diseases, all that. So you can kind of see what that is all about. Questions about that? Wow, quiet group. I love that. I don't know if that's because you're all asleep, didn't have enough coffee, or if we're presenting this okay. All right. So here's what I'm going to say as far as next steps. Number one is take a deep breath. I know it's a lot of information. It's a lot of going back and forth. We're here to help support you. Probably your first thing is to review those standards and start collecting documentation or organizing the documentation according to standards. I'm sure you have it. It's just all matters where, or where are there holes, or where is there opportunities then to review those again. Ask questions. Please reach out. At the end of this slide, you'll get my contact. You'll get Jennifer's, you'll get Callie's. Let us know. We can help. The next thing is then to upload and I would say upload and resubmit, but I don't know if are there ones, there's some that have gone through mentoring with us, and we just like to ask if you've been mentored and you've already had standards reviewed, it's just important that you take a look at them again for this camp season and to see if there's anything you need to update, and then resubmit that and by the portal. And once again, it says by April 1st, just because we want to make sure that we have enough time for our visitors to be able to review those so they can get that done by June 1st. Communicate with your visitors. And other than that, let's just hope for a really fun, silly, safe summer. So I think the last slide is, here's how you can contact us. And once again, like I said, a copy of this will be following to you real quickly. So at this point, I will just do this and say, question, thought, impression. I love dog and cat impressions. No, I'm joking.
Tell them to breathe.
Yeah, to breathe.
So I was going to just kind of give like the next steps, Brian. What's
going
to happen is some of you already have a login because you were mentored, and so that should be the same. But some camps have not been assigned an own Microsoft email and a password to get into the portal. So that is coming this next week, okay? And yeah, I would just start just looking at your documents that you already have. If you need to digitize anything so you're able to upload it, work on that. And then what I would tell you is do the easiest ones first. Don't start with standard 1.1. Okay, go do the easiest ones first. Like go get your child life specialist and your child psychologist's license and upload a photo of that, or go and put your camp application on there, or your volunteer surveys, or their reviews from last summer. Do the easy ones first, because you know, it'll help. It'll help if you can knock some of those easy ones out. And look, I mean, we're here, you know, to help you guys get through this, because what we ultimately want, we want to set you up for a successful visit so you can become accredited. I mean, it would my heart happier than to see all of the 17 camps that we are to go to this summer have their visit and become accredited. That would just be huge and wonderful. So just let us know how we can help you. There's no silly question or crazy question, or I just don't get it. Don't worry about that. We're all figuring it all out together. And if you're having issues with portal, like I said, let us know immediately. There could be something, you know, on the technical side that's not working properly. So
Great.
any questions?
Great input.
Yeah.
Cool.
Okay.
Anything else from anybody else? Lauren, any great keys being on the committee?
No, it's not as scary as it sounds. It's actually a really fun process when you get to camp and have folks visit you. You learn so much from each other. It's not it doesn't feel like a formal evaluation, even though it technically is. It just feels like you're getting to know some new peers, which is great.
Yeah.
Thanks, Lauren.
Yeah, very true. And like I said, it helps me sleep at night. Have I done what people that have better minds than I have put together as far as how to make a safe and silly experience for these kids? And by having that resource and considering that for our operation just helps me sleep at night. So I hope it does that for you as well. Cool.
Okay.
Well, I'm looking at this and I'm so excited that it looks like there's 20 minutes of your life back. I always like to do meetings where you get a few minutes back, and probably just how I ran through it so quickly, and hopefully it wasn't too quickly for all of you. Like I said, after this, what you can expect is you'll get a copy of this from us in PDF form and that kind of a thing. And once again, with all of contacts and those kind of things, use those. Other than that, you know where we are. Oh, if you haven't already gone into chat, put in your name, put the camp where you're from. Please do that just so we have a record of that. All right. Well, great, friends. Thanks
Thanks
for
guys.
allowing us to chat with you today. And let's look forward to a real safe and fun summer.